Hello, my name is Kathleen Sciacca, and I'm a consultant and a trainer and educator. I've been in this field for quite a long time, more than 30 years, but since 1984, I've been providing training and program development and consulting for the development of programs for people who have dual diagnosis. And in 1992, I began to also teach motivational interviewing. For the past 17 years, I've been a motivational interviewing trainer. I provide training, consulting, and program development in that field as well. And I'm a member of the MINT, the Motivational Interviewing Network of Trainers. I've also been the director of the MICA training site, New York statewide, for the New York State Office of Mental Health. Some studies have shown that very few doctors actually address behavior change in their meetings and visits with their clients. White and her colleagues did a study at the University of Virginia where they trained medical students in motivational interviewing. And as a result, the very large numbers of those students, 83%, felt more comfortable in addressing behavior change as part of their work, and 98% felt that it was an important skill for other doctors to learn. I believe that all doctors can benefit from learning how to practice motivational interviewing. Motivational interviewing is a communication style that differs from the traditional work that we normally do in all fields, including primary health care, which is to ask people a series of questions and then provide them with advice. In motivational interviewing, the communication style is really throughout a collaborative partnership. The client's ideas, feelings, perceptions are a valued part of the interaction, of the process of the health regime. It's not an afterthought. The person is engaged, and actually the doctor would elicit this information and not have the client, simply try to fit it in whenever they can. And that would be the sign of someone who's practicing motivational interviewing well. And that would be someone who can really elicit from the client and listen to what the client is saying and provide a response that reaches the client in a way that says, I understand why you're saying that. I understand why you're feeling that way. That your voice is important. There are quite a few communication skills in motivational interviewing. Some of the central ones are called the 5 strategies. And as I talk about this a little bit further, I'm going to try to define them a few and give you some examples. One of the most important skills in communication and motivational interviewing is reflective listening. That is the work of Carl Rogers, and he has really perfected it, and it's not the easiest skill to learn, but it's an essential skill in this model. Here, the practitioner listens to the client and reflects back in the form of a statement what they heard them say, what the feelings are they might be picking up, what the person's perceptions might be. But first and foremost, the practitioner wants to convey to the client that they understand what they're saying. And that might take more than one reflection until the client says, yes, that's right. I don't like coming here. It makes me feel like I'm sick and I'd rather stay home. That's what I meant to say. And the practitioner has responded to that in a way that they understand it with neutrality. Okay? And here's where the authoritarian element of communication is really eliminated in motivational interviewing. It's non-authoritarian and non-judgmental, so that the responses are done in a neutral way that just is really conveying, I understand that, I understand. I may not know that may not have ever happened to me, but I could understand why you feel that way. And this kind of response really invites the client to continue to talk and to explore things in a meaningful, genuine way. And in motivational interviewing, this is one of the objectives. We want to discover why the client wants to change, why they would want to participate in a regime that may have side effects and discomforts. What's in it for them, rather than our telling them how to do. So one way to look at it is that there's more listening than telling in motivational interviewing. Another one of the 5 strategies is called open questions. And that would be generally how we would start any interview. And we try to use open questions as much as possible rather than closed questions. So an example of an open question would be, so tell me, what would you like to talk about today? In contrast to a closed question, which might be, have you been taking your medication 3 times a day, as we discussed the last time you came in? So you can see right here that the closed question lends itself to a shorter answer. I can say yes or no and not even expand any further. Whereas the open question, I need to give some kind of an answer that would then allow the practitioner to reflect it back and to begin to follow for a little bit. And we're not talking about hours or even 50, we're talking about perhaps opening a session like this in maybe 3 minutes of listening, evoking, following, asking open questions, and finding out where that person is today. Or if we were actually discussing a goal behavior or a target behavior, then we would ask open questions as well to see where the person is at right now before we start giving advice. So open questions are something that are used throughout motivational interviewing and compared to closed questions. But there are times when closed questions are absolutely necessary. And we need to ask those, and we try to keep those as open as possible, particularly in the medical professions where people need to know specific information. But one wants to not rely upon them, but be able to be flexible and move back and forth with open questions. Open questions accomplish a number of things. For one thing, it really facilitates engagement, whereby the client will more likely keep talking and feel comfortable. And once they feel listened to and that the practitioner is making an effort to understand them, then the setting begins to feel more safe and comfortable to continue on to talk. So actually the practitioner knows if they're engaging and doing well if the client keeps talking to them, which is really what they want to happen. In motivational interviewing, we want the client to make the argument for change rather than the practitioner. The practitioner may very well know what's best for the client, but we want the client to discuss, and we want to evoke from the client their reasons for following a regime, a health regime, or changing habits, or whatever it is. What's in it for them? A difference might be, the doctor feels someone's blood sugar, would be lowered if they did a certain thing, and the client might feel they need to do that certain thing because they don't want to pass away too young when their grandchildren are around. They won't be able to, have all these events in their life. These are 2 very different motivations. And in motivational interviewing, it is the client's motivation that will guide the change process and move to some real change. In fact, I think one of the distinctions you could look at is that it is intrinsic decision-making and change by the client rather than outside pressured or coerced. So that, and that's really what the model is going for.